I'm back again, twice in one night. Wow. I actually got done with clients early today at 6 p.m., which is early for me. So I had some time to kill and I'm hanging out in my office. But I am going to now talk about what the heck a mental health carve out plan is. And you probably heard that term being thrown around. Besides it being the bane of my existence, it is when mental health benefits are covered under a different insurance plan than the medical insurance. So a client will come in and say they have Blue Cross and Blue Shield when it turns out they do for their medical benefits, but for that particular plan, their mental health is covered under what's called a mental health carve-out plan, and that could be a completely different company than their medical insurance plan. So they could say they have Blue Cross, which you're in network with, and they have a mental health carve-out plan to, let's say, Beacon Health Options, and you're out of network with them. That would mean that you're actually out of network with that client's plan. What you would do is then bill Beacon Health Options instead of Blue Cross because you're a mental health provider, and if you would bill Blue Cross, the claim would get denied usually because they do not cover the mental health benefits for that client's plan. Now this really throws a lot of clients through the loop because they don't even know that they have mental health carve-outs usually. But that's why verifying benefits before you see the client's really important, so you can know which company to even bill. A client would get confused, say they have Blue Cross, and I just usually explain, listen, Blue Cross covers your medical benefits, but you actually have your mental health carves out to another insurance company, and you can either be in network with them or not. And if you're out of network, then you would do the whole out of network spiel with them. But if you're in network, that's great. Some of the common mental health carve-out plans are Magellan Behavioral Health, Beacon Health Options, also known as Value Options. See, sometimes United Healthcare is a mental health carve-out. Sometimes Aetna is a mental health carve-out. It really depends on the plan. What I've sort of done is whenever I do come across a plan with a mental health carve-out, I just keep kind of mental tally of it because it usually varies based on employer. So certain employees or employers would have a carve-out plan. So you just sort of know okay, wow, this person's from the same school district that this other person, and they work at the same place, so they have the same carve-out. I just usually keep track of it. A lot of times, at least in Illinois here, Blue Cross and Blue Shield HMO plans, some of them do carve out to Magellan Behavioral Health, and I just know that based off of their, what's called the group plan, or the group site for HMOs. So it's really just comes with experience, and that's why a lot of times you have to verify very carefully how to kind of spot a carve-out plan. There's a few different ways. The first way is always calling to verify, so calling the insurance, the customer service number, calling the insurance representatives, and they'll tell you that the mental health is carved out to X and X plan, and they'll usually transfer you. I often take down the number too, just in case, and I save that in my phone actually because I'm that nerdy, and so that for future reference. You can always call to verify the insurance. Sometimes on the back of the insurance card, it'll actually have mental health benefits like Magellan, and it'll have the Magellan number. So then that's a good indication. Another one is when you're checking benefits on Availity. Say you are in network with the medical provider or the medical insurance, and you see authorization required all over the place, that odds are that's a carve-out plan, and I would probably call the insurance company, the customer service number at that point. Sometimes when you're verifying the insurance on Availity, there's that little tab that you first see the client's information on. They're address and everything. I'm doing this from memory, so hopefully I'm remembering correctly. if you scroll down a little bit, sometimes it'll say secondary payer, and sometimes it'll list the carve out there. But I find that that's kind of rare that it actually does happen like that. Sometimes I'll just recognize a carve out plan from the prefix code or just the type of plan. Like I said, lots of carve out plans. I know for Blue Shield in California, they carve out a lot to Magellan Behavioral Health. So you just sort of like know from experience, like, okay, it's this employer, I know they have a carve out, or oh, it's this type of HMO plan, I know they have a carve out. So just sort of keep a mental tally. But that's why it's very important to verify insurance benefits before seeing the client, because odds are you'd be billing the medical insurance and then your claim would get denied, and then you wonder why, and then you have to go through the whole thing again. So to avoid it, verify the benefits and bill the mental health carve out if it's a carve out, not the medical insurance. So if it's Blue Cross and Blue Shield for medical and Beacon for the carve out, you would bill the carve out. So you would bill and put it in your system, whatever, if you use an EHR or Office Ally, as the carve out plan, so as Beacon. So hopefully that helps clarify what a carve out plan is. They're still tricky. They still kind of confuse me at times, but hopefully you'll be able to recognize them better and explain them better to your clients.